I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And once again, bringing to you the insights and the action steps that you're going to want to take in whatever situation that you find yourself when it comes to be about your own personal health. But today's a very interesting and special show, which you'll find out soon enough with my amazing guests, Kim and Evka, as they will navigate a certain kind of problem that may or may not relate to you in particular, but has very much relevance in many countries of the world. And so, the purpose of this podcast, the Doctor's Guide to Curate, Educate, and Guide, is to help you discern the process by which you can make the best decisions for yourself. And it's designed for not only the consumer, but physicians as well. And last time I checked, physicians tend to work in all sorts of countries and all sorts of interesting situations as well. So tune in so that you get to experience some of the challenges that people have in order to help others or themselves to optimize their health. And why is it that we actually do this? Well, in today's world, with so much information, so much technology, and other types of resources that are available to optimize your health, it can get very confusing. And so if you have a Google PhD, I mean, that might help, that might not help. I mean, AI might confuse you even more depending on how skewed AI really is. But at the end of the day, it's really your responsibility. And people don't like this term, but it's your responsibility to make the right decisions for yourself, even when you've got the best doctors in the world. And so what I mean by that as well, here's the thing. Today, there's no longer an excuse to be sick because we've got the technology, we've got the information, we've got the amazing people like every guest that's on this show to help guide you towards optimizing your health. But at the end of the day, number one, you got to agree with the plan, understand the plan to begin with as well, and make the right steps and action steps forward. And so, whilst there are many podcasts out there espousing all sorts of things and selling all sorts of products that may or may not be beneficial for you, this podcast is really all about sharing the process by which you make better decisions because I don't know who you are. I really don't know what it is that you need. But my hope through role playing, you get to experience the process of making better decisions for yourself or for somebody else that you really care about so that you have the discernment and the ability to make the best decision for yourself and then ultimately optimize your health or if you're a medical practitioner, help optimize somebody else's health as well. And so after my introduction, I'll have each of my guests introduce themselves. We'll then go into about a 6 or 8 minute role play where one will present with a very specific problem and the other will act as a guide. And you might be thinking, well, 6 minutes is not a lot of time to solve a problem. And you'd be right, but you'd be surprised how much can be solved. But my hope is that you actually witness yourself in the process, opens your listening, and you discover a very specific distinction or action step that you can take, even if it's reaching out to these amazing guests of mine. So welcome, Evka. Welcome, Kim. Thank you so much
Thank
for
you.
joining me today. It's a great pleasure to actually experience this incredible opportunity that is being presented by you two today. So very grateful for that. So Evka, please introduce yourself, then Kim, and then we'll jump into the role play. Evka.
Hi, so my name is Dr. Evka, and I've been a family physician for, oh gosh, almost 2 decades, um, seeing patients in all kinds of scenarios. I'm a refugee from Eastern Europe. I came here when I was young after escaping communism, became a physician, and now do a bunch of things, see patients regularly in the inner city. I'm involved in some overseas medical care and in minority populations and helping get them get the care they need. I have a platform that's kind of like Duolingo, teaching physicians and other health care professionals other languages. And of course, I see patients.
So you're amazing, Evka, on so many different levels. Not only is your heart and empathy extended to all these individuals that are sometimes very unlucky and don't have access to the possibility of optimizing their health, which I really respect because the work that I'm doing, by the way, to make it ridiculously easier for anyone to be able to access the information, the tools, the resources, and the people to optimize their health. And part of my company is dedicating, at least a minimum of 10% specifically for groups like yours that can also access optimum health. So thank you for what you do. Thank you for giving it back, and really appreciate, because you're very amazing. Kim, thank you for joining us today.
Oh, it's my pleasure. Thank you for having me as a guest, and thanks for the opportunity to have a great conversation with Dr. Evka. I'm Kim Tranquada. I am an emergency physician with 27 years of experience in emergency medicine here in the United States. I am the founder and CEO of the Healthcare Alliance for an Equitable World, where we're on a mission to make the world a more equitable place in our lifetime. We invite our collaborators, volunteers, and donators to co-create a world where all people have access to the best doctors, therapists, and healthcare around the globe, regardless of where they live or how much money they have, and to create a unified, galvanized global healthcare community to provide care, learn from, and inspire each other, and be empowered to create an equitable future for all.
And that's a beautiful mission. And I have good news for you. Hopefully, this is good news for you. If I'm very successful, which I plan to be very, very successful in all the work that I'm going to do, that I will help people stay healthy so they don't have to actually go to the doctor in the first place. So, but I can see that we will be working together on so many different levels, because here's the truth. Access to medical care is so important. Problem is that there's so many limitations and restrictions and what have you, and it's up to people like yourself and Evka and myself that make it even more unified and democratized for everyone. So thank you for what it is that you do, and you're also a leader and an example in this world. So Evka, I know that you're presenting with a problem. You have 6 minutes.
Thank you. So for this, although I am currently in New Jersey, for this role play, I'm going to pretend that I'm in Ukraine. And all the trucks behind me are trucks that are in Ukraine, and I'm in the car because hospitals have been bombed, ambulances have disappeared. And so the kind of medical care that we now provide is more house call based or clinic based, where we go into a specific area and provide care. And I need help because a lot of doctors have left Ukraine, given the situation there. And so there's minimal people who, in terms of a healthcare infrastructure, and people are getting sick. The people who are left are sick, and some of them are even sicker because they haven't been getting the access to care that they would otherwise, because there's so few of them that are available to provide it. And some medications are hard to come by, and some of the medical procedures that people need, just harder to get time in an operating room, given the situation, or even find or create an operating room. How do you, given what you do, provide care in remote areas of Africa?
Efka, first I want to say your vivid description of the need should motivate and galvanize thousands of people to your side to help carry out this care. And I want to ask you, as a primary care physician, as a family physician, emergency care is dear and dear to my heart. And certainly I'm imagining your role has grown into trauma care, into all kinds of care, because you have to carry out what's needed for the people that are available. What's your greatest current need?
There's a whole bunch of needs that we need. I think we need more people. And one of the ways we're getting more people is through telemedicine. But we are winding up with like more healthcare professionals, but we're winding up with issues with providing internet access, providing electricity. So And then we're running also into issues with the language barrier because sometimes the person we're getting on the line doesn't, like the healthcare professional,
Mhm.
doesn't understand the culture and doesn't understand the language.
Yeah. Yeah, those are all, I mean, very important and relevant needs. You said you've experienced a little bit of telemedicine and you need more people,
Yes.
yet you are in a conflict zone and people are leaving, and it's I'm imagining it might be difficult for you to recruit people to physically be there.
Mhm.
What has worked well when you have had telemedicine?
What has worked well is providing access. Um, Having somebody there is staying, who's available, who can act, maybe doesn't have all the necessary information, but can act as a translator, and can act to bridge some of that cultural barrier.
Yeah.
And as that's happening, as we're talking to them and we're providing services, and there's somebody there who acts as that, they're getting some of the medical knowledge themselves and are becoming braver in the kinds of procedures and what they're willing to do themselves.
Yeah, I believe that physicians are amazing humanitarians that come with an amazing heart and will step up and do the things that need to be done with a little support. But I do think it has to be done, with cultural competence and in the appropriate language. Would it be helpful to you if you could have access to hundreds of physicians with different specialties to provide you with guidance by telehealth at
I
your bedside in real time? I think it's important that it be in real time with you, wherever you are, in your car, wherever you can provide care at that moment.
I think that would be wonderful because then we can amass a bigger um, workforce. We still need the people here on the ground to be able to
Right.
provide it and bridge the gap, given the language and given the culture differences.
Yeah, we absolutely need your community of physicians there in Ukraine to be the not just translators, but to tell us what's available. Like you said, how do you get medication in a conflict zone? How do the patients even get water? These are really essential every day. How do you clean your equipment? Uh, how do you carry out a procedure that's going to give you the best outcome without ideal circumstances? I think I can imagine all of those things are dire needs.
And trying to get the help for it because some of this help winds up being volunteer. It's not, or not really well paid because there isn't the money
Yeah.
being.
What keeps you going? What makes
Got
you keep
1 minute
going?
left, guys, to wrap it up.
Thank you. And I'd love to have further conversations with you. And you've asked some really good conversations. I'd
I do
love,
want to make sure that we can help you also bridge the electricity and the internet gap so that we can really support you and your incredible community. And what do you need for those physicians that are there to continue and do this work? I definitely would want to keep in conversation and really help you tell me how we can help you. But I think the global physician community will lean in and be galvanized by your need, because at the heart of the work we do very difficult things because we want to make a difference in the world.
you absolutely do. And you're a living example of that because you're doing something similar in places like Africa. I think we have to take this conversation offline because I think we only have a minute, but let's continue it. And
Please.
thank you.
Thank you for the invitation to chat with you more. I look forward to it.
Thank you. Thank you.
Great job, guys. Thank you. So first, Evka, please give us some context. What was that all about for you?
So there are many challenges to providing medical care who are people who are left in the Ukraine. And we need to be thinking about them too and figuring out how we can provide just a little bit more care under the circumstances.
Right.
And Ukraine's important to me because I'm from Eastern Europe and I'm a refugee. I've spent part of my life in a refugee camp, and it's important to give back.
Yep. No, excellent. Kim, give us some context. What was that all about for you?
I mean, it's such a compelling situation and such a compelling problem, and to know that if we could mobilize even 1% of the 13 million physicians we have globally to carry out some of this work and support the people that are, I mean, their whole lives disrupted, right? And what a big difference it can make for the people's healthcare, their dignity,
Yep.
democracy. I mean, this changes us as a healthcare community when we can come together across nations, across political divides, and really work towards a common goal like this. I would want to continue to learn what they need and figure out how they can help. I truly believe that people will come together to do the right thing.
Well,
Yeah.
thank you for that, Kim. And I just want to read a quote first on my own website and give context as well. I was very fortunate. I grew up in 5 different countries. I was originally born in Holland, and my journey in medicine actually began more as a humanitarian and humanitarian efforts worldwide, which I continue to do in a variety of different ways. But the quote that I have on my website for all my humanitarian efforts, and I've gone to Sri Lanka and other countries to help with, these crises. I'm going to talk about crises in a moment before I give you guys the mic. But what does our future hold if we can't find good in all and improve it? And where is our humanity if we can't find greatness, even in desperate times? Our faces reflecting hope for a better future for those in need. And here's the truth, is that all of us at some point in our lives likely have major challenges, major crises, and somewhere, somehow, somebody gave you a helping hand to overcome them. And so the reality is that so many countries, so many peoples all over the world are suffering in a horrific way that we really need to begin to prioritize, how it is that we spend our time and how it is that we spend our money to certainly help others. And the question that we all have to ask ourselves, how many trillions of dollars in my pocket is enough? Not my pocket, but there's certainly a lot of people with trillions of dollars in their pockets. And not to democratize that and not to ostracize them. I mean, I'm excited that they have been very successful because these individuals have also helped the world in a major way. But the truth of the matter is that there's enough around to help those in dire need. And as long as we can keep it out of the pockets of the people that are abusing it, I know that's always a major challenge. And so rather than going down a political rabbit hole and all that kind of stuff, the truth of the matter is that we all can help others in need. And even, helping somebody, cross the street. And it's getting into that space where we are helping others. We give value to other people before we take it ourselves. And the world suddenly becomes a better place. And we need to recognize that countries like Ukraine and others are in desperate need on so many levels, no judgment on any sort of way. People are people, and we need to stop beating each other up. Kim and Efka, I hand over the mic to you guys, starting with Efka. What is it that you want to share? And then we'll go with Kim.
I love your quote, Dr. Bart. We can all be the changes we want to see in the world. And it's often a small group of people who create major impact, especially if they're passionate about a situation, because their hearts are in it for various different reasons. The passion can go a long way. One of my favorite songs is Hands by Jewel. My hands are small, I know, but they are not yours. They are my own, and I'm never broken. And we on this planet can be God's eyes and we can be God's hands, to make the world a better place. And it starts with showing up for and being of service to those who are less fortunate, who we can literally save their lives and or make a huge impact in their lives in very tangible ways.
Love that. Thank you for that, Kim.
And medicine is always an incredible privilege. And for my lifetime in emergency medicine, meeting people at the most critical moments of their lives when they are the most helpless and the most scared, and sometimes at their worst selves, is really a privilege. And I think this is if we don't like conflict, if we don't like war, if we want a future that is peaceful and where people do actually get along, we need to meet people when they're at these really dark moments and uplift them. We can't look away and concentrate our efforts only on the few that already have and keep giving them more. We have to share, and there's enough to go around. The pie doesn't run out. There's enough to go around, and it uplifts us. It builds us as a community, and it creates the future that we want to see. You can't leave someone abandoned at their time of greatest need and expect the future to be peaceful. That scar is carried forever.
Yeah, and let me be clear, we're not talking about handouts. And I think too many people are expecting handouts. These are desperate times for people that really have no recourse. And it's really on the hearts of some people that are out there, laying their own lives on the line to support them and to save them. And it doesn't only go for people, it goes with animals too. I have my 3 beautiful Maine Coon cats. I really love those cats, and I'm surfing on Facebook sometimes a little bit too much, but I'm doing that because I got my podcast. And so now I'm kind of finding out what else is going on. And it's just horrific to see, how people are mean to animals as well. And so it goes for animals, it goes for people. And it's really not that hard to be actually kind to somebody else. And this is what's so mind-boggling. Everybody's so focused on themselves, being the victim, being in pain. Pain is inevitable, but suffering is a choice. So we need to stop suffering. We need to be grateful for what is and take the time and the effort to do something for somebody else. And just giving out money is not necessarily enough. The fact, the random act of kindness, makes a huge difference, and it can happen in all ways. And I do want to do one shout out because you did allude to something there, Kim, and that's this. Doctors are a very special breed, and they have laid their lives on the line. They have sacrificed so much, and nowadays they're losing their autonomy. They're losing their ability to do what it is that they're best at for so many different reasons, which is why I am also motivated to help my doctor colleagues out there regain their autonomy and regain the ability to thrive and be able to do what it is that they do best, and that's healing people. And nothing will ever replace the healing hand of a doctor. And so the point that I'm getting at is, as patients, we got to recognize, the challenges that these doctors have, the limitations and the stresses that they're undergoing, and also give them a helping hand as well, because they're committing their heart, their time to save you, and they're fighting in what I would call a hostile environment. And I'm just stating the facts. It's getting harder and harder to practice medicine in the way that people are designed to do it best. And so once again, the work that I do is helping doctors have that autonomy, because with that autonomy, guess what, Kim and Evka, they'll be able to go to Ukraine or other countries and support more people. And we don't have to wait for 1%, but what about 5%, of the, was that 13 million doctors globally? And why not? And for a conversation for a separate time, I established a foundation called the Medical Wellbeing Medical Frontiers specifically to help people bring humanitarian efforts worldwide. But I want to give the mic back to both you guys because what you have to share is so important. I'll give it back to Kim first. What else would you like to share that people know about what it is that you do? And also, how do people get a hold of you?
So first, please go to our website, https://HAEW for Healthcare Alliance for an Equitable World.org. And from there, you can reach out to me by email, you can volunteer, you can donate. We've been able to do incredible work with just collaboration. This is really the vision of the future, where we have tech company that has provided a telehealth platform that can let us connect with people. We have the IEEE, the International Electronics Engineers, come together and put solar in rural clinics, in boarding schools for refugee children, and into hospitals so that they can connect by telehealth. So you put the infrastructure, you give the computer, and then hundreds of doctors that have volunteered to be available online to help support a nurse that's in a boarding school, a nurse that's in a very rural clinic 4 hours away from the main hospital, or the rural hospital that's hours away from the main city with specialists that they don't have because they only have a primary care physician and perhaps a nurse. So hundreds of doctors coming together to do this work. There's no transaction here. This isn't a monetary thing. This is people wanting to be part of a global community, make a change, and be part of bringing healthcare into the future. 78% of the world are getting a very small percentage of the healthcare. Most of the healthcare is going to 22% of the world, and the other 78% gets 6.5 times fewer healthcare workers and fewer healthcare infrastructure. Let's uplift everybody. It will help us with disease. It will help us with conflict. It will help the world be more economically viable. And for us as a healthcare community, it will help us bring that autonomy back, because now we're not just a little group of people working in one hotel, in one hospital. We're a global community connected to each other.
And that's the brilliance of technology, bringing it all together. Interesting enough, some people feel that they're even more separated and isolated because of tech. But the truth of the matter is that as doctors, even if you spent 1 hour, if every single doctor spent 1 hour a month, just giving some support, we'd solve all sorts of problems. And the beauty of that is that, sometimes I think people are very hesitant to, make any donations because you never really know where they actually end up going. But now you do, because you're face to face with helping somebody, seeing the results, and the joy and the rewards of that in of itself are tremendous. And so as a listener, be you just a regular consumer or a doctor or another healthcare professional, absolutely, check into this website, check into Kim as well, and help out. Absolutely. Evka, final words from you, and how do people get a hold of you?
Okay, thank you very much. I think as doctors, especially during our residency training, we were I remember working for way under minimum wage, like 80, 90, 100 hours a week. And I did that for years, like as we all did. So the money isn't the motivation there at that point. When you're being the backbones of the hospital system, the motivation is making a difference in other people's lives. And so as we move forward in as physicians and we're out of residencies, I don't think that part leaves us. I think we're still these people in the world who are trying to really impact lives and make a significant difference in health and in helping people in some of their most dire moments. And so I think as physicians, we are where we put our money, like, or where our beliefs are, and what really matters to us is we're such people of service. I do a lot of house calls in the inner city, in New Jersey, in various places where there might be gangs or it might be the projects. providing care to people who otherwise don't get it. And I also try to do some international work. And language is a big issue, as is culture. Most of my patients here speak Spanish or other languages. And we have a problem with translation and with translation services. And if you accept certain insurances, you're supposed to have a certified translator. That might cost you $1.50 to $2 a minute, depending upon which service you use, which basically eats up a lot of your pay. And it might not necessarily even be the best care. What we need to do as doctors is we need to be able to understand our patients better, both culturally as well as language-wise. And so I have a program, a software program to teach medical professionals other languages. I started with Spanish. Now I'm speaking to my patients like I didn't know Spanish very well until I started creating the app. And now I speak to my patients in Spanish. It makes a huge difference in them trusting me as a provider and me being able to provide the appropriate care. And we can do that in other languages as well. And so the software program is called Clinical and like clinical polyglot. So it's Clinical. And otherwise, you can also find me on evkamd.com, evkamd.com. The language program is it's fun, it's educational, and it teaches you languages pretty quickly.
Awesome. Yeah, and absolutely. I mean, it's kind of challenging when you can't speak to your patients and then trying to decipher, you know, the complexity of what's really going on in the first place, even if you speak the language. And so definitely the barrier is even larger when the language is the barrier. And I've been always very surprised and myself fortunate because I'm fluent in Spanish, you know, how many patients that I had to take care of that had no English whatsoever. And so for me, it was easy to navigate, but it was a challenge when, you know, they were from Asia, and I certainly don't speak those languages. But I want to thank you both. What you both do is grandiose. It's grand. It's amazing. It's a beacon for the rest of us to be able to see and also contribute in whatever small way that we can. And even if it is a small way, there's so many different ways that we can contribute. And the threshold now is so much lower to overcome to be able to do that, because I do know that one of the reasons most people don't do anything is because they don't even know where to go to. And besides, the burden may seem, you know, overwhelming. And obviously you guys are making it so much easier. So thank you for this. This has been a very special podcast, once again, to show the rest of the world that yes, we are very privileged in this country. I think we're very spoiled in many respects. It's a humanitarian crisis worldwide. We're not enabling others. We're just helping others in crisis because we can. So I want to thank you both. And my name is Dr. Bart Rademaker, and this is the Doctor's Guide Podcast, raw and unfiltered, bringing to you the kinds of conversations that we really need to have these days, because too often we can't, and too often it's either confusing, or too often they're overwhelmed by different voices and different noises, so you don't get to hear them at all. And that is why it's raw and unfiltered. Some people might get triggered, some people might get offended, but the truth of the matter is, in my opinion, if you get triggered, that is a good thing, because in a way, that's a message from the deep that says, there's something that we need to work on, because at the end of the day, we all want peace. We all want divine happiness. And so if there's any dissonance within you, that's your work to do, not to judge, but to learn, to grow, expand, and become even more human. Thank you so much, and I'll be back.